I'm afraid to go to the dentist is unfortunately a comment we hear a lot. And part of that is based on the past experiences that the person has had. We saw it a lot more. You see it a lot more in the baby boomer generation. I'm one of those. I can remember as a kid having a cavity drilled on and with no anesthetic. And I can remember even the dentist saying, do you want a shot? Well, what kid wants a shot? So, so I would always just suffer until finally one day I realized, wow, you can be numbed and it doesn't have to hurt. But a lot of it is just past experiences, people that were impatient with that patient, didn't allow for proper anesthetic, and then just all the stories people hear too. It all plays a part into it. So one of the things I discovered in dealing with fear in patients is the number one is you got to develop a trust, and that doesn't happen easily because that person comes in, they're skeptical, they're cynical, they've heard that before, they don't want to hear it, and so you've got to start working on a trust. A lot of people just explaining things to them, teaching them a little bit is enough, but there's still a large segment that can't. And what I finally realized about midway through my career is if I'm going to help these people, and I want to because there's a lot of people out there in that kind of need, they need to have something to get them beyond just raw, positive, you can do it. No, they need more. And so what I found is in cases like that, that's where the sedation has been so beneficial, is we can take people that truly have a fear and we can sedate them. We have various means. We can do it with a simple oral drug if we need to. We can do it with nitrous oxide, and then we can also do it with IV sedation. But once you get them through a couple of procedures, and once again, like I said, they have success at that and they realize that it wasn't too bad, and quite honestly, with the sedation, most of the time they don't have any memory of it anyway. Then you have somebody that their barriers start dropping. They start realizing, wow, I can actually accomplish this. And then from there, then you can go on and take them to that next level. And many times in our sedation type of patient, we're able to take them from just hardly walking the door to a couple years down the road. They come in, they're smiling, and then amazingly, they'll have work done and they don't need sedation. So that's how we deal with our fearful patients. I also try to have a type of personality that I listen to people. I want to hear what their fears are. I want to hear what caused them to have these problems in the past, and then not be too dominating on them. I want them to be part of the process, that I bring them along with me, so that when they're there and they're ready, they can finally take that gulp and do what they got to do. So that's how we deal with our fearful patients.